Hey everybody, welcome back to another Super Loopie Woman video where we discuss different chronic pain conditions. I'm Caitlin and I'm very happy to have you back here at my channel. Thanks for visiting and I really hope that you can consider hitting the subscribe button, giving me a thumbs up. It's totally free for you, but it really helps me out. Alright, so today we're going to talk about a different kind of chronic pain condition, which is not directly related to lupus, which is the main focus of this channel. So March is Endometriosis Awareness Month, and 1 in 10 women will be diagnosed with endometriosis during their childbearing years. I was diagnosed in December 2018, so that is today's subject. So stick around. What is endometriosis? Endo meaning internal, and metrium meaning womb or uterus. And endometriosis is when the endometrium is growing outside of where it should be. So it should be in the uterus, but it can grow in other parts of the body, such as ovaries, fallopian tubes, intestines. It can grow lots of places where it shouldn't, and it can cause terrible, terrible pain. So that's why I'm raising awareness about it this month, which, like I said, March is Endometriosis Awareness Month, and a lot of people have no idea what that is. So I hope that you stay tuned to get educated. I do understand if you're not cool with hearing about the female reproductive system, maybe this video isn't for you, but I will link above another video that I hope that you check out. So now that you know what endometriosis is, let's talk about some of the symptoms that come with it. This list is by all means not an entire list of everything that you could experience while going through or dealing with endometriosis, but these are more of the common symptoms. So we have pelvic and abdominal pain. It feels like pain and pressure. Think of menstrual cramps times 1,000 with lots of stabbing pain. Not fun. Not fun at all. We have bloating, constipation, and nausea, which aren't pretty side effects, but you know what? It's true. No fun. Actually, endometriosis can grow on your intestines. It did for me, and just wreak havoc on your digestive system. We also have severe and heavy bleeding. This could happen during your menstrual cycle, but it doesn't have to. It could happen at any time. We have severely painful intercourse, severely painful defecation, urgency or frequency of urination, and infertility. Infertility can affect 1 out of 3 women who have endometriosis. Another thing would be chocolate cysts. So what's chocolate cysts? That sounds neat. It's not. So what it is it's an ovarian cyst. It's a little cyst, well, could be little, could be big, cyst on your ovary, but it's actually endometrial lining that is growing there, and it's filled with blood, filled with old tar-like blood. And when they rupture, they're excruciatingly painful. I've dealt with these a couple of times. I cannot even think of words to describe it to somebody who hasn't been through it before. Just severe abdominal pain and pressure, and I hope none of you ever have to go through it. So let's talk about diagnosis and treatment. So first things first, you need to be talking openly and honestly with your OBGYN or your obstetrician gynecologist. If you're a woman, you should have one of these. If you don't, you need to get one. So you need to express your concerns, express the pain that you're having, the severe symptoms such as heavy menstruation, heavier than normal or painful intercourse. It's not normal. It's just not. You need to talk to a doctor about it. And some of you may not feel comfortable talking to your doctor about it. And if that's the case, I want to tell you to find another doctor, because I can't tell you how many times I have had to fire a doctor because I wasn't comfortable and I didn't trust them. So if you're not comfortable with your doctor, please find a new doctor, find somebody that you trust, and discuss these things with them. Surgery is the only actual way to officially confirm an endometriosis diagnosis. It's not able to be seen on an X-ray, ultrasound, CT, MRI. It's not able to be seen. If endometriosis is suspected, they may order these tests to rule other things out, such as ovarian cysts or appendicitis, things of that nature, an obstructed bowel, something like that, that could also cause abdominal discomfort. But actually having a laparoscopy is the only way to actually confirm the diagnosis. The laparoscopy is a surgery. It's minimally invasive. They just make a few incisions at the abdomen and they go in with some little tiny tools, as opposed to like old school cut you open you up surgery. So it's a lot less invasive. They're going to look around. Basically, they inflate your tummy and your abdomen with gas. I can't remember the name of the gas. CO2. And they use a light and tools to look around and see what could possibly be wrong. So if they see endometriosis cells, they're going to take a little piece of it and do a biopsy just to confirm. So as far as the removal goes, they could do an excision or an ablation. So an ablation is just going to get the cells on the surface out just to temporarily relieve your symptoms. Now if they do an excisional, then that is actually removing all of the tissue, which is harder to do. It's more invasive. Some other treatment options for endometriosis would be a full hysterectomy, which is the removal of the uterus. Sometimes it could mean the removal of other organs in the female reproductive system as well, but that can only help if the endometriosis isn't growing on other organs of the body, which is an important fact because for people like myself suffering from endometriosis, mine is growing elsewhere, so down the line a hysterectomy wouldn't really help me. They also treat endometriosis with hormonal therapies or oral contraceptive pills to keep all of that at bay, or, which I call a total joke, NSAID pain relievers, which is a non-steroidal anti-inflammatory drug such as Tylenol. To me, these are kind of a joke. If you would like to hear more on the subject of endometriosis or my personal journey, stay tuned. There's going to be another couple of videos coming up for Endometriosis Awareness Month. Thanks so much for watching, and I really hope that you would consider hitting the subscribe button on my channel and giving me a thumbs up. Totally free for you, but it really helps me out. Have a good day. So, what's endometriosis? Am I saying that right? Endometriosis. Having a laparoscopy. So the laparoscopy. Whoa, I cannot say this word today. Sorry. The laparoscopy. So what they do at the laparoscopy, I can't say this word today. Can't say it. During the laparoscopy surgery,